A new Chinese coronavirus, a cousin of the SARS virus, has infected hundreds since the outbreak began in Wuhan, China, in December 2019. Scientists believe it is likely started in an animal and spread to humans. It's not clear how deadly the Wuhan coronavirus will be, but fatality rates are 41 as of the time of recording this video. Coronaviruses are a large group of viruses that are common among animals. In rare cases, they are what scientists call zoonotic, meaning they can be transmitted from animals to humans. Don't forget to like, share, and subscribe to the channel. And if you like those videos, please ring that bell. The viruses can make people sick, usually with a mild to moderate upper respiratory tract illness, similar to a common cold. Coronavirus symptoms include a runny nose, cough, sore throat, possibly a headache, and maybe a fever, which can last for a couple of days. For those with a weakened immune system, the elderly and the very young, there's a chance the virus could cause a lower and much more serious respiratory tract illness, like a pneumonia or bronchitis. There are a handful of human coronaviruses that are known to be deadly. Middle East Respiratory Syndrome, also known as the MERS virus, was first reported in the Middle East in 2012 and also causes respiratory problems, but those symptoms are much more severe. Severe Acute Respiratory Syndrome, also known as SARS, is the other coronavirus that can cause more severe symptoms, first identified in the Guangdong Province in southern China. According to the World Health Organization, it causes respiratory problems but can also cause diarrhea, fatigue, shortness of breath, respiratory distress, and kidney failure. Depending on the patient's age, the death rate with SARS ranged from 0 to 50% of the cases, with older people being the most vulnerable. The Wuhan coronavirus is currently thought to be more mild than SARS and MERS and takes longer to develop symptoms. Patients to date have typically experienced a mild cough for a week, followed by shortness of breath. There is no specific treatment, but research is underway. Most of the time, symptoms will go away on their own, and experts advise seeking care early. If symptoms feel worse than a standard cold, see your doctor. There is no vaccine to protect against this family of viruses, at least not yet. You may be able to reduce your risk of infection by avoiding people who are sick. Try to avoid touching your eyes, nose, and mouth. Wash your hands often with soap and water and for at least 20 seconds. Awareness is key. If you are sick and have reason to believe it may be the Wuhan coronavirus due to travel to the region or coming into contact with someone who has been there, you should let a healthcare provider know and seek treatment early. Cover your mouth and nose when you cough or sneeze, and disinfect the objects and surfaces you touch. If traveling to China, be aware of symptoms and avoid live animal markets.